Type 2 diabetes is increasingly common and younger due to a sedentary lifestyle and a preference for fast food. Equip yourself with the necessary knowledge to confidently ask your doctor for effective treatment to help quickly reverse the disease and live a healthier life. Currently, many people under the age of 20 have type 2 diabetes due to lack of exercise and improper eating. To deal with this increasingly common disease, you need to equip yourself with the necessary knowledge. 1. Type 2 diabetes is a chronic disease. Type 2 diabetes is a chronic, incurable disease that occurs when blood sugar levels are high. Unlike type 1 diabetes, where the body cannot produce insulin on its own due to a problem with the pancreas, the body of type 2 diabetes can still produce insulin. Although the pancreas is still functioning and producing insulin normally, there is insulin resistance, so the cells in the body cannot use glucose in the blood as an energy source. This leads to high blood sugar and over time will cause a lot of damage to the body. 2. Being overweight can lead to type 2 diabetes. Being overweight or obese can hinder the use of insulin, thereby increasing the risk of type 2 diabetes. Even patients with active lifestyle changes and weight loss of 5 to 7% weight after 15 years, the risk of type 2 diabetes can be reduced compared with people who do not change their lifestyle. But increasingly modern life makes many people gradually less active and prefer fast food. This unhealthy lifestyle will gradually lead to overweight and thereby lead to type 2 diabetes. Currently, diabetes is one of the common diseases that many people suffer around the world. 3. Age of type 2 diabetes is getting younger. Children can develop type 2 diabetes. Type 2 diabetes used to be more common in adults 40 years of age or older. In 2014, the 45 to 64 age group was diagnosed with the most diabetes. But recently, more and more children and young people have diabetes because obesity tends to increase in children. In Vietnam, there is now a case of diabetes when only 9 years old. First, in 2012, a study in the United States predicted, based on a model, that by 2050, the number of people with type 2 diabetes in the United States under the age of 20 could account for up to a quarter of all patients with type 2 diabetes. This model also predicts that at the current rate of increase, by 2050 the number of people with type 2 diabetes under the age of 20 in the United States will increase by 49% compared to today. 2. 4. Type 2 diabetes has many complications. If left untreated, type 2 diabetes can lead to many serious complications, including cardiovascular disease. When you have type 2 diabetes, your risk of other heart problems increases dramatically. Cardiovascular diseases you need to be careful of are coronary artery disease, myocardial infarction, stroke, atherosclerosis. Nerve damage. Too much blood sugar can damage the small capillary walls that nourish nerves, especially peripheral nerves. This can make you feel tingling, numbness, burning, or pain in your toes first and then your fingers. Some people with poor blood sugar control also experience complete loss of sensation in the extremities. In addition, the autonomic nervous system can be damaged, which will affect the digestive system, causing nausea, vomiting, diarrhea or constipation. For men, nerve damage can lead to erectile dysfunction. Kidney disease. Diabetes can affect the kidney's ability to filter waste out of the blood. This condition can lead to kidney failure and the need for a kidney transplant or routine dialysis. Eye damage. Type 2 diabetes can cause damage to the blood vessels of the retina, which can lead to diabetic retinopathy and potentially blindness. In addition, the disease also increases the risk of other eye diseases such as cataracts and glaucoma. Skin diseases. Type 2 diabetes can increase your risk of skin problems such as bacterial and fungal infections. 5. Manage type 2 diabetes with lifestyle. You should have regular check-ups for type 2 diabetes. A healthy lifestyle can help you better manage type 2 diabetes to prevent complications. Some good habits you should adopt include: be physically active. A regular exercise routine will help you control your weight and blood sugar. You just need to walk for 30 minutes a day, 5 days a week, to improve blood sugar and reduce cardiovascular risk. Avoid eating a lot of starch. People with diabetes need to avoid consuming too much starch because this is a substance that can raise blood sugar. To know the amount of carbs you can eat daily, consult your doctor because each person's starch needs are different. Keep your mind at ease. Only by staying positive can you build a healthy lifestyle and cope with diabetes more easily. Quit smoking and stay away from smoke. If you have a habit of smoking, you need to practice quitting gradually to improve your health. Moreover, you also need to avoid exposure to second-hand smoke because second-hand smoke also has negative effects on the cardiovascular and respiratory systems. 6. Take medicine to control blood sugar. In addition to exercise and dietary changes, medication also plays an important role in controlling type 2 diabetes. In fact, the condition can be well controlled if you take your medication as prescribed. Doctor. When you go to the doctor, ask your doctor what medicine is most appropriate for your medical condition, how to use it, whether it is injected or oral. You should avoid taking medication according to word of mouth or advice of non-medical professionals. If you do your own research first, you will confidently ask your doctor for information about quality medication when treating type 2 diabetes. This will not only speed up the treatment time, but also know how to take the medicine so that you can take it. Achieve the highest possible efficiency. A quality drug is one that has gone through a rigorous research and approval process. This drug will have to meet the strict standards of drug registration of FDA, U.S. Food and Drug Administration, or EMA, European Medicines Administration, to be put into use. Do not be afraid to ask, because this fear will prevent you from understanding your doctor's prescription for effective blood sugar control. Moreover, if you take the medicine incorrectly, there is still a risk of unwanted side effects. Type 2 diabetes is on the rise, but it's still manageable by leading a healthy lifestyle and consulting with your doctor during treatment. You can completely live a healthy life with this type of diabetes if you strictly follow the treatment regimen and proactively request quality drugs that are suitable for your economic conditions.